Welcome to Stand Up for Doctors. I'm your host, Kim Downey. Thank you so much for being here. If you're a doctor, your voice matters, and on this podcast, you'll hear from colleagues who are choosing connection, courage, and humanity as they navigate today's healthcare climate. If you're a healthcare leader or a patient, your voice belongs here too, because these are the stories and conversations shaping the future of care. This podcast is about connection, advocacy, and building a healthier future for doctors and patients. If this matters to you, please like and subscribe. It helps these voices reach the people who need them most. And I would like to share that we're hosting an amazing physician retreat October 9 to 12, 2026 at Windrose on Hudson in Ossining, New York. It will be a soul-filling event for doctors. CMEs will be available. Please reach out for more information if you're a doctor interested in attending, or if anyone would like to sponsor our retreat. We can create sponsorship to fit your budget. The registration link will be in the show notes. And today I would like to welcome Dr. Nkem Ezeamama and Kasey Pacheco. Thanks for joining us today, Nkem and Kasey.
Happy to be here.
Thank you for having us.
You're welcome. By way of a brief introduction, Nkem is an ER doctor turned investor, and Kasey is a nurse and CEO of Preservers of Life. And today we'll be talking about how there's a path laid out to becoming a doctor or a nurse or a physical therapist. And then sometimes healthcare workers get a feeling, is this it? They might have an inkling that they want something more or want something different, yet they might not have the bandwidth to explore what that might be. And you've both taken bold steps to chase your dreams, and we'll explore the process you each went through as examples of what's possible. So, what would you most like our audience to know about you as we begin our conversation? And Kim, would you like to go first?
Sure. Thank you so much for having me. I'm really excited to be on the podcast. But what I would like the audience to know, I guess for me, it would be that anything is possible. And if you put your mind to do exactly what you want to do, you can do it. There's no one perfect path. There's no one purpose for everyone. You figure that out, and it might change in a year or two, and that's okay.
I love that. That really resonates with me. So, thank you for sharing. And Kasey, what would you like us to know about you?
I am a board certified holistic nurse. So I believe in everything works out for you, and it's not just possible, but if you desire it, it's meant to come through you. So I really believe in the embodiment of whatever it is. Sometimes we go to help other people, but we have to help ourselves first. So I definitely believe in the possibility, and that you want it because it's you. You're the person.
I love that too. These are great messages to share already. And I also like it when our guests share a powerful story. And Kim, could you share, your path to trying new things?
Yes, absolutely. I am a board certified emergency medicine physician. I've been doing that for 11 years, or about to be 11, 10, and some change. But at some point, I started just looking for more, thinking about wealth creation, and what it means to not rely on just my 9 to 5 and not to rely on just one employer. And so that led me to the path down real estate. And I realized that ownership is power, and we can do it together. And so I formed Phoenix Capital Investment, where we bring healthcare professionals together, and we buy large apartment complexes with the idea to build passive income on the path to generational wealth.
That's terrific. And Kasey, would you like to share your path to entrepreneurship?
Yes, my path to entrepreneurship actually it came on quickly before I was even thinking about a business model. My husband and we were taking care of this elderly couple. They didn't have any children, and we built a hospice company to care for them. And basically, we just brought the whole community together. This gentleman served the community, and he was dying. And I just looked around at the healthcare system, and I was like, this is crazy what we are providing for people. I mean, there are so many fragments, they cannot navigate the system. And I just thought, as as educated people who have so much technology, we could do a better job at caring for people and really making them partners in their care. So basically, I just started, and it started me on this entire journey. And I wouldn't say I figured it all out, but I am well on my way. And I really believe, and right now I'm doing marketing and really helping people who are serving others to become more visible in what they do. But it's at the base of it, it is collaboration, collaborating for the patient.
Yeah, that's great. Nkem, if you would like to respond to or ask Kasey anything, and then I'd like to you to share something about limiting beliefs. If other doctors are listening and they might say, "Oh, well, that's great for you," but
So I completely love what Kasey said and kind of how the journey found her, right? It wasn't something that she knew from day one that she was going to do this. She was just doing something that she was called to do, and then it opened up. And I think that is a lot of our paths. A lot of us went, we started doing one thing, and then kind of a door opened, and you thought, well, I can increase my impact. I can change, I can move a community to change. And I think I love that kind of sharing that, and people need to hear that. And in terms of limiting beliefs, we have so many. I would just kind of name a few that come to the top of my head. Like, I am just a doctor. I don't know anything about wealth creation. I maybe struggle with financial literacy. I'm a woman. Who's going to listen to me? I can't sell to anyone, right? Who will invest $50,000 with me? No one. And all of these, I can go on, right? Like, how can I even build a community of 1,000 people, right? Or more, 1,000 healthcare professionals, 1,000 physicians? I can keep going. And all these limiting beliefs are real. They feel very real. But I would say that if you change your mindset, right? If you understand the power of I can do it, or you put in the work every day, right? It's one thing to change your mindset, but you have to put in the work and you have to be consistent every day. These limiting beliefs can be crippling, right? Because they can feel so real, especially because we're trained to do one thing, right? And saving lives is such a big, it's such a wonderful opportunity that we get to do. So the idea of thinking about doing something else sometimes can be, people will not understand it, right? But you have to know within your heart what you want to do, what your purpose is, how you define the life that you live, because we have this one big, beautiful life that we get to do whatever it is that we want to do with it. And so chase that dream. But you have to be able to overcome some of these limiting beliefs. And I'll say this last part. You have to build an army. You have to build, and it doesn't have to be an army of 1,000. It's an army of 1 or 2 or 3, but you have to build people around you who will keep you accountable. People around you who their dreams should scare you. That means you're not dreaming big enough, right? You're not trying to change. If like if a huge impact has been put upon your heart, right? Then you surround yourself around people who keep you accountable, so that every day you wake up, you continue to pursue that, you continue to chase that, you continue to follow that. And I think if you do that, right, you will begin to quench some of these limiting beliefs, and you will change your narrative, you will change the story, you will change your mindset.
That's great. Kasey, what would you like to add to that about limiting beliefs?
Oh, if I could just hop on Dr. Nkem's, everything she says. The biggest part of my holistic model is financial well-being. There is no impact. There is no impact to your purpose. If you're passionate about something, if you don't have financial literacy, it is only going to go but so far. And I believe in feminine energy. I believe in allowing things to come to us versus chasing things down. So what Dr. Nkem is doing, I believe it's the way that as professional women, we are going to impact the world by building passive income. and understanding the power of not just our skills as a doctor, nurse, physical therapist, but also understanding the impact of our dollar and where we put it. I believe heavily in investments and real estate, even though I'm not there just yet. I'm learning the stock market, but I really believe that this is a very key part to healthcare because we it takes us from being victims, it takes us from having to ask someone for something to being powerful leaders where we can actually say, I can care for my own health and the well-being of my community because I know how to maximize and operate financial resources. And it is very, very important what you said about mindset. A lot of the way we were brought up, the traumas, the things that we were told is still playing in so many of our heads. I see physicians, nurses, and they are very educated, maybe lived a lifetime well paid, but their bodies don't reflect it because they did not live an enjoyable experience because their own trauma is still playing in their head, their own perspective, not even theirs, what they got from society, from their parents, the limited beliefs still holds them back. So this is a lot of inner work to change our perspective, to think differently, because this is what's going to bring about all the changes we want to see, not just our passion.
That's great. And Kim, if there's anything you'd like to add, and then also doctors have shared that you don't really learn about business skills, and doctors might not have an idea if they just wanted to take one step, if they had an idea, like what would, how do you just take that first step?
Okay, that's a really good question. I think that you don't have to spend in the beginning, right? As you're thinking through and you're building, you don't have to spend a lot of money until you truly have, something that you have proof of concept with. So I would say the best thing that has helped me was reading books. There's so much knowledge in powerful books that you can start, books on entrepreneurship, books on wealth creation, books on buying back your time, books on starting a business, right? So I would say that's a great place to start. And then after that, the World Wide Web, YouTube University, Facebook groups, right? You can join these groups and you can start learning from there. I think those are really great ways to start. I do believe in coaching. So I believe in, like I paid to go to medical school. I paid for that education. I feel very confident and okay with paying for coaching that will move me steps ahead without, not necessarily without, I'll do the work, right? But like a hand, a helping hand to kind of help me instead of crawl, maybe I walk a little faster or I will start jogging to get me to where I'm going. So I completely believe in that. But before you decide, right? Some of us decide that we're going to go to business school at the end of the day. And some of us kind of, the different paths open up. But I would say that as you're thinking about it, right? There's tons of resources out there to just kind of help you even gain some knowledge so that you can then really decide, is this something I want to do? I will say this, right? The idea of entrepreneurship, of building, right? It is hard. This is something that, I want, if nobody tells you, if somebody's selling you this glamorous picture of like, do this, pay me this money and I'll create this, it's not necessarily true. It is hard work, but it's fulfilling work. It's work that you wake up every day and you're like, I want to do this. I want to make a difference. This is something that has been put on my heart. I want to build this. I want to own this. I want to empower others to do X, Y, Z, like whatever it is, right? And so even though it's hard, it's very fulfilling. But you have to put in the work. You have to, whether it's small steps, but it's steps that you're taking every day.
Mm-hmm. That's great. Kasey, anything you'd like to add? And then if you'd also like to speak to fear and how you move forward past fear of trying new things.
Oh, so beautiful, Kim. And I agree with everything Dr. Nkem said. I just wanted to add, for me, I have to be humble and say, I tried many business models and they have failed. And I end up going to school to get my MBA because I'm like, there's obviously something I don't know. I also say the biggest thing I learned so far, and it's very humbling for me, is to learn to accept help. I couldn't even take a compliment. So that's the first step I had to say. Someone say, "Oh, you look so beautiful." Thank you. I put effort into this. And just knowing that when people come, I pray to God, "Oh God, make this help me. I need help." But here it is. I'm getting paid and unpaid help coming. I can help you do this. I can help you manage your social media. I can help you do this. And I said, no, 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 no. I could do it all by myself. I went to nursing school doing my hair by myself. I do my makeup for myself. I do everything for myself. And that became my identity. But I have two small kids and a big, big vision. So I had to learn it's okay to have someone come help me clean my house. It's okay to have someone help me watch my kids. It's okay to accept help because you need help, not just in the business, but in your life, in every dimension of your life. So that's one thing I would say in addition to what Dr. Nkem said. I really, really appreciate it. And fear, I'm learning that within me, I have leadership skills and leadership qualities, but the fears that I have to undergo to do what I want to do is not the fear that, oh my gosh, this is big and I might lose all my money, but it's the fear of saying, you deserve something better. You deserve to be more than what you were given. Sometimes it's the fear of greatness. Sometimes it's the fear of looking like a failure. Sometimes it's the fear of just showing up and saying, hey, I have an idea and I think this is wonderful and I just want to share it with you. And you may reject me, but that's okay. I think less of fear and more of that internal courage to show up every day for myself and for what I believe in. It's so easy to let little fears, not even the big ones, the little fears stop us. And I always say, go until you can't go anymore. Just every day, one step. What could I do that I couldn't have done yesterday? And maybe I might get a no, but go until, I learned not to internalize that no. Go until I hear no. And that's what I have to share.
This is really inspiring. And Nkem, what would you like to add in regards to doctors asking for help and facing their fears?
Oh, I like what Kasey said about the fear of greatness, but I think that in this world, we're not an island, right? You're not an island of just me or just you, right? And we have to reach out. We have to seek help. And that help looks different, right? It also looks different in different seasons, right? So the help that I need right now is not, like creating an LLC. The help that I need right now is thinking about scaling, right? And so there are different needs as you grow. But I would say to not be afraid to reach out. You don't know who would benefit from you asking. You don't know who's going to benefit from, like from pouring into whether it's your business or your whatever skill that it is. So I would not stop. I would I would ask, if somebody's struggling to just pause and realize that this is just bigger than you. And I would also say that fear is so crippling, and you might be one step away from a big vision, a big dream, a big idea, but you're so afraid of, like, what will they say about me at work, or what will my colleagues think, or what if I fail, or what if I don't succeed, or what if. And I would say to that person, I would just say, feel the fear and then still push through, right? I would say courage is not the absence of fear. It's to feel that fear and still decide that I'm going to do that thing, right? I'm going to create a course. I'm going to create my LLC. I'm going to, whatever it is, like however small you want to start. I'm going to speak on a podcast. I'm going to share my story. I'm going to do a webinar to teach healthcare providers about this, to teach doctors about taxes, whatever it is, right? If you it's just one small step every single day, and you realize that fear that seemed so insurmountable was so small, and all you had to do is put the reps in every day. All you had to do is show up every day. All you had to do was be consistent. All you had to do was find a circle of people that you can push through with. So I think that if you're really sitting and just if you're sitting and you're afraid or you're like, I don't know, right? I would say just do it, right? What's the worst that could happen? Look, what is the worst that could happen? You fail? Okay. You are one failure away from success. Like you've done that, you've moved, you've learned that, okay, that's done. Let me do it again. Like I love the idea of fail fast, right? Fail forward. It's just like, okay, let me do that thing wrong. So then I know 1,000 more right ways that I can do it to get to my solution. That has to be the way you have to start thinking as an entrepreneur. And I know it's different from how we think as medical providers, as physicians, right? We cannot afford a failure, right? We can't afford because lives are truly at stake. And so I get that. But when you venture into this world, right, of building, of entrepreneurship, it's a little different. So I would say it's okay to let go of that in order to move forward in this.
Mm-hmm. That's great. And we've all been in helping professions and it feels good to help other people. So we have to keep that in mind that other people might like to help you as well. And that's a gift that you're offering other people, right? When they can
Yes.
help you. And speaking to that internal dialogue of what if I fail, you can flip it on its head and say, what if I succeed, right? And if you'd both like to share a story, is there something that comes to mind where you did struggle and move forward? Like an example you can share, like that it wasn't the end of the world, like that didn't work, but you were able to move forward still. Kasey, does something come to mind?
Um, what's coming to mind is, and I don't want to deviate too much from your question that you asked, but it just came to me, so I'm going to share it. So I got into marketing and I'm helping someone with their business. And my client, as I started, because I do this holistic marketing and really telling why are you not visible in your life and really helping her become visible online, but offline in the back while I'm coaching her, coming to find out there's so many things that not only is she good at, but she really desires more than even the business she's promoting. And one of the desires she really had was to have a baby. And I worked with this client for a year and a half. And in the year and a half, she made strides. She 3 times her income. But, this past December, she just had her baby. And her life is so profoundly changed. And I share this not just to talk about marketing or holistic, but just our identity could be so wrapped into I'm a nurse, I'm a doctor, I help people this way. But sometimes the way we start off helping someone, the real help might just be who we are, being called to pull people or draw people out. And I just wanted to share it because I think it's a story where we don't know, we might set out to do something first, but we may have to pivot. We may have to do something different, and that's okay too. So I just wanted to share that.
Mm-hmm. That's great. Nkem, do you have anything to add? Like if you had to made a pivot or
Um,
challenge?
so I'll share the story because I think it's really important. Earlier on, when I started building Phoenix, I had a lot more no's than I had yeses, and I'm grateful that that has changed now. But I remember in the beginning, I was just struggling, because I didn't know who was listening. I didn't know who was, paying attention. I didn't even know if I was making a difference, right? I didn't even know if I was talking to anyone. I would jump on webinars and I'm like, well, 1 or 2 people joined in. And an investor called me and it was a woman physician. And she said, I just want you to know that we see you. And she did not know my struggle. And she said, I want you to know that we see you and that you need to keep going. And she said, there are a lot of us who are a little bit older who are stuck in where we are, but we don't know how to pivot and we don't know what to do, right? So we just continue in our path and we're doing well in medicine, but maybe that's not all we want to do. But maybe years have passed and we don't know if it's the right thing to do to pivot. And so she said, you have to keep going. And then she said, I would love it if you could mentor my 2 girls who are teenagers because I want them to see all that is possible. I want them to know that Like we don't have to be one thing. If they want to be doctors, great, but if they want to do something else, that's also good, right? And I remember leaving that conversation in tears because she doesn't know what she did for me. Because even if I thought for a second I was going to quit, I knew I would never do it. I knew that no matter what, right? I was on a mission. And if one person heard it, if 1,000 people heard it, I had to keep going. I had to keep going for those two young girls. I had to keep going for my future kids. I had to keep going for everyone else who saw me and thought and just felt like if she can do it, so can I. And so I would just I just want to talk to people who are, healthcare professionals, whether doctors, nurses, dentists, pharmacists, whatever it is, right? If you're just thinking about doing something, right? Even if it feels like no one is listening or no one is hearing you, if it's something that truly is on your heart, right? I would say just keep going. You don't know, how far away you are from striking gold, 6 feet from gold, 1 feet, you just don't know, but you have to keep going to get there, right? Success really just comes with reps and consistency, and it's just doing it over and over. There is no such thing as an overnight success, right? It seems that way because maybe one day somebody noticed you, but nobody knows the amount of work that you have put in the background to get to where you are. So I would just say, just keep going.
Well, that is so true, and these are such empowering messages. So, as we wind down, I'd like to ask you each for like one sentence. If you were going to have a take-home action message for our audience, Kasey, what would you say? And Kem, go ahead after.
I would say you were patient number one. Love and take very, very good care of yourself.
For me, I would say if I was talking to my younger self, my 10 years younger self, I would tell her, this journey is hard. You don't know tomorrow, but you have to keep going because your 10-year older self is so proud of who you are, where you're going, and the best is yet to come.
Well, that's great. And Kasey, how can our listeners get in touch with you if they want to learn more?
My website, preservativeLife.com, and I am very, very easily to reach on LinkedIn, Casey under Kasey Pacheco.
Okay, that's terrific. And Nkem, how about yourself?
Same with me. All you'll find me on all social media platforms, but LinkedIn is one of my favorite platforms. And so if you just type in my name, you'll find me. But yes, any social media platform, I'm there. My website is www.phcinvest.com. But if you reach out to me on LinkedIn, I'll definitely respond.
Another LinkedIn fan. We got three on the call. Fantastic. So thanks again for being my guest today. I've loved this conversation and I look forward to sharing it.
Thank you for having us. This was beautiful.
Bye,
Yeah.
everyone.
Yeah, you're welcome. And I'd also like to add to please reach out if you're interested in sponsoring an episode. It truly helps to sustain this work. And in closing, to move the needle in healthcare, we all need to raise our voices and we all need to care about each other. We already know that doctors need to care about patients. Patients need to care about doctors too. So stand up, doctors, and let's stand up for doctors.